Good afternoon, everyone, and welcome. My name is Gary Parker. I'm the Associate Dean for External Affairs at the Brown School at Washington University, where I have the great privilege of serving as the inaugural director of the Clark Fox Policy Institute. And welcome to the Brown School's Open Classroom series. While we're all kind of socially distancing and socially isolating, this is our way of opening the doors to the Brown School and allowing you a peek inside and to hear from some of our world-renowned faculty on topics that you may be interested in or know nothing about, or if you're just kind of interested in advancing a little bit of your professional development. I want to share with you that coming up, some really interesting discussions, particularly I want to promote the one on June 11th at 10 a.m. will be part 3 of our COVID-19 and race series. This one will focus on political action and power in the face of adversity. Given what is happening with current events, we think this will be a particularly poignant and salient conversation, and we hope that you to join us. You can register for that event through the Open Classroom portal on the Brown School website. If you're interested in part 1 and part 2 of that particular series, they are both posted on the Brown School's YouTube page. So you feel free to see that. And this particular talk will also be posted on the Brown School's YouTube page following its live broadcast. I want to let you know that due to the high number of attendees, and we've already crossed that 100-person mark, and we're so grateful for that. We cannot see or hear you, but we want you to be engaged in this conversation. So I want to strongly encourage you to use the chat feature to send us your thoughts and your questions. And my co-host, Janet Gillow, who is the Director of Professional Development, and I will curate those and then feed those questions to Professor Kreuter. So with that, I'm going to hand things over to Janet. Janet, how are you doing this morning?
Doing great, Gary. How are you?
Good.
Okay, so it is my great privilege to introduce my friend and colleague, Dr. Matthew Kreuter, to deliver today's Open Classroom talk. Dr. Kreuter is the Kahn Family Professor of Public Health, who specializes in health communication, cancer prevention and control, integrating health and social sciences, and health disparities. In addition to his teaching role at the school, he's the Senior Scientist Director at the Health Communication Research Laboratory, delivering today's talk, tracking the social and economic impact of COVID-19. So with that, please join me in giving an open classroom welcome to Dr. Kreuter.
Janet, thanks very much. And Gary, thank you as well for inviting me. Just to pick up on Gary's promotion of the next one of these open classroom events, what an extraordinary time we are experiencing. So this presentation is going to focus on some things that we're learning around really a once-in-a-lifetime pandemic, and this has been pushed off of the front pages for a week now due to the death of George Floyd at the hands or knee of the police. And it's really quite a moment for all of us. And while our path forward, I think, is still unclear, being engaged is the duty of all of us. And so I want to take this moment with this platform just to say that I think wherever you are on the political spectrum, we really need people to be highly engaged in solutions moving forward. And it's going to take work on the part of all of us. And here at the Brown School, one of our critical missions is to prepare students to do just that. And we as a school have to be ready to meet that moment. And I think we are working very hard to do that. Our faculty and our staff are. And for our students and prospective students who might be listening in today, just a reminder that our fields of public health and social work and social policy need you more than ever before. And this is really, I think, a defining moment for our country and for our fields. And so we encourage you to come ready to work and learn in the fall, and we're excited to interact with you again. So as Janet said, my name is Matt Kreuter. I'm a professor of public health at the Brown School. The Brown School is a pretty remarkable place to do the work that I'm going to talk about today. which lies at the intersection of public health and social services, and has a lot of policy-related implications. And so I feel really fortunate to be able to work with outstanding people here. The work I'm going to talk about today is going to share how we are using big data from a very unique source with our United Way partners to really understand what's happening in the pandemic. But the truth is, this idea of tracking the social and economic impact of COVID-19 doesn't even require data. I think for most of you, you're probably quite familiar with scenes like this. I think we started early on with shortages of things like toilet paper. We have seen remarkable miles-long lines of cars filling parking lots, waiting to get food, people helping, taking neighbors through outdoor food pantries, buses from Alaska, seen here, to Florida, taking meals to school children who are dependent upon free and reduced price lunches, but with schools closed, can't get them. All sorts of employment disruptions for Americans in some sectors and some communities with really dramatic and major impacts, trickling down to sort of our latest sort of social and economic implication or fallout from the pandemic. People being unable to pay for their rent. In April, for example, almost a third of renters were unable to make their rent payments. So these are the images that we have all been seeing in the news. And so in some ways, what I will share with you more quantitatively will provide perhaps some context for that, but you're familiar with the general story. I want to provide a little bit of background to what I'm going to talk about today. And one of our key partners for 13 years now has been the United Way 211 helpline service. And it's important for you to understand this service to understand some of the impact data that I'm going to show you. So I want to take just a minute to orient people to 211. Hopefully, most people on the call have heard of 211. If you haven't, it's a 3-digit phone number that is designated by the Federal Communication Commission, just like 911 for emergency, or if you're old enough, 411 for directory assistance. But if you call 211, if you call those 3 digits anywhere in the United States, your call will be answered by a live operator at a call center, most likely in your community. And that you'll be talking to a live person who's sitting in front of a computer, and that computer is attached to a database, and that database has a list of all of the health and social service agencies and the services they provide in your community. So if you have a particular need related to food or rent or utilities or diapers, they're going to be able to search their database to see where there might be a program or a service that could help you do that. Now, to give you a sense of the degree of complexity of this coding system, so they record every request that they receive, and there are over 10,000 categories in which 211s classify this information. And just to illustrate this with a concrete example, if you are homeless, but you have a car, and you are living out of your car and sleeping in your car, and you need to know where in a community is it both safe and legal for you to park your car, to sleep in your car, there's a code for that. So a very high degree of specificity in this coding. And so 211s across the country are taking millions of calls, over 10 million calls every year, and they're capturing the reasons for these calls. And they're capturing them down to the zip code level on a daily basis. And so what our team did beginning about 7 years ago is we started building a data dashboard system that we called 211 counts to try to liberate some of the data that these 211s across the country were capturing. Because the 211s, if anything, were just sort of maybe summarizing the high points of their service requests in a quarterly report or maybe an annual report. But we really felt like what the 211s had created was really the best surveillance system of social needs in the country, and that a resource like that needed to be available more than quarterly or annually in order for it to drive impact, in order for it to inform decisions and resource allocations and help communities set priorities and identify goals. And so we created 211 counts. It is a data dashboard system. It's open and public. I encourage all of you to visit if you haven't already. The 211 counts national homepage looks like this. All of those states that you see in dark green and the ones in yellow are all states that use 211 counts. And so while we continue to grow every month, it is still a pretty substantial penetration across the US. And if you click on one of those states, you will arrive at a dashboard that looks like this, which will tell you up to the prior day how many people are requesting what kinds of services. And we have them classified in broad categories like housing and food and healthcare and utilities and mental health and employment and so forth. And then within each of those categories, there are many subcategories that provide greater detail about what people's needs are. And we map this so you can see not just what are the needs, but where are they being experienced disproportionately, and what are the time trends? Are certain needs increasing? Are certain needs falling? So this is a tool that we had created, and much of what I'm going to share with you for the remainder of our time together builds upon this tremendous resource that 211s and United Ways across the US have compiled. Each of these blue bars is one day, and they represent every day of 2020. And the pattern here is pretty unmistakable. So these bars are showing how many people called 211s looking for food assistance. And you can see that things are holding steady pretty much through the first 2 months of 2020. And then there's the black line that you see right here. And this is the date on which the COVID outbreak is declared a pandemic on March 11th. And what you can see is within days of that, an unbelievable increase in food requests across the country. And even though the number of requests has tapered off week by week since then, it is still dramatically higher than it was in the months before the outbreak. And actually, I would say that these declines are a bit misleading. If you call, for example, 211 trying to find where there's a food pantry near you, you don't have to repeat that call week after week, even though you may need food week after week. So I would encourage you to think of the height of these bars as representing in many ways, not exclusively, but in many ways, new callers who are looking for new information. We can break down this information again, so these are all food requests. We can break it down by the types of food requests. And what we see when we do this is that almost 3/4 of all the requests to 211 for food needs are related to food pantries. Where can I go to get food for my family? The second biggest category, accounting for about 14 or 15% of all food requests, is help buying food, which really means people who are trying to apply for or determine their eligibility for food-related programs, like SNAP, the Supplemental Nutrition Assistance Program, or WIC, the Women, Infants, and Children Program, which provides food to pregnant women and new mothers. Home-delivered meals increased dramatically during requests for home-delivered meals. Increased dramatically in the period post-COVID, as a lot of particularly older adults, disabled adults, sicker adults were unable and it was unsafe for them to leave their homes. They needed home-delivered meals. Feeding children, it's a small percentage here, but much higher than it would be in an ordinary time during the school year because kids can't get food at school. Here we have aligned food requests with projections of unemployment rates. So along the x-axis here, the horizontal axis, these are counties in the US that have a projected unemployment rate post-COVID of anywhere from 20 to 35%. So these are outliers to begin with in terms of the expected unemployment. And what you can see is that requests for food generally increase as projected unemployment goes up. And this will be a theme that we return to, is linking these request data with some other sources of data to try to gain insights about the impact of the pandemic. And then we can also make these pre-post comparisons. So I mentioned March 11th in the afternoon around 2 p.m. Central Time is when COVID officially became a pandemic. That's the demarcation line that we use. And so everything before that we call pre-COVID, everything after that is post-COVID. We now, within 2020, we now have more days that are post-COVID than we do pre-COVID. But we can use that as one indicator of how some of these needs, these social and economic needs, have changed. And so one of the things that we've done is looked at where particular needs have grown the most. And so this is a sample. This is not necessarily the top 7, but this is gives you a sense of some of the places and the degree to which food requests, and I'm just using food as an example here initially, where they have risen the most. So Minnehaha County in South Dakota, this is where the Smithfield meatpacking plant that had a widespread outbreak is located. Monroe, New York is Rochester. Broward, Florida is Fort Lauderdale. Wayne County, Michigan is the Detroit area. Jefferson, Alabama is Birmingham. Allegheny is Pittsburgh, and Summit County in Ohio is Akron. So we can identify places where that are being particularly hard hit, and we can go even deeper. We can take one of those counties and go to a much higher resolution. So here's Summit County in Ohio, and the map on the left shows us the per capita rate of food pantry requests since the COVID pandemic began. And what you can see is, even though Akron, or rather Summit County as a whole, had very high increases, you can see that those increases are not uniform. They are much more pronounced in some of these sort of central zip codes, which are plotted on the map and shown with the darkest blue. And as you radiate out, the rates of food pantry requests decline. And then the map on the right is showing the increase from pre to post-COVID in food pantry requests. And what's interesting is that the biggest increases are coming in some of these outlying zip codes. Just to illustrate that it's not just the typically impoverished zip codes that are experiencing some of these social and economic consequences. And just to make this Summit County example a bit more maybe memorable perhaps. And to make what I think is another important point, I want to invoke LeBron James, perhaps one of the, not perhaps, one of the most famous athletes of the current day. He's from Akron. And there are two yellow dots that I've placed on the map here, one in the dark blue zip code, and that's where LeBron grew up. And so he lived in a house in one of these darkest blue zip codes, and the zip code where he grew up has generated, or this is now probably 4 or 5 weeks old, but at the time had generated 1,000 requests for food pantries from that one zip code. The dot that is above and to the left of that dot is where LeBron built a mansion and still owns it now when he was playing with the Cleveland Cavaliers. That zip code generated 18 food pantry requests during the same time period. So adjacent zip codes, one of them generates 1,000 requests for food pantries. One of them generates 18 requests for food pantries during the first 2 months of the pandemic, illustrating the nature of the inequalities that characterize so many communities, certainly no stranger to St. Louis in terms of the impact of some of these, the impact of the pandemic. Just another example, this is Rochester, New York. But what we can do using these remarkable data from 211s and United Ways is we can actually begin to make comparisons across different areas. So here we've got Monroe County, New York, which is again Rochester, Washoe County, Nevada, which is Reno, Jefferson County, Kentucky, which is Louisville. And we can look at some objective indicators of, what does the relative need look like in these different places? How many people are affected in terms of the population? What are the trends? How are these how are these requests rising relative to the rest of the state? We can also look at disparities. What's the difference between the top 25% and the bottom 25% in any one of these counties? How big is that gap? How intense is the need in terms of the surrounding area, something we call neighboring need, and concentrated disadvantage? Do these zip codes, do they only need food, or do they also have elevated rates of housing challenges and utility challenges? So I'm not going to get into the particulars of all of these metrics, except to say that using these powerful data, we can begin to get a picture of places and needs in communities that really are crying out for attention. So we've done a lot in partnership with United Ways and 211s to leverage these data. And what I'm going to talk about for the remainder of our time is one particular example that we are calling Focus 19. So I'm so proud of the team I work with, which is just a tremendous group of faculty and research staff and graduate students. Within a week of the pandemic becoming official, we had stood up a new web page called Focus 19. Again, this is open and public. I encourage people to visit it. And what we wanted to do was measure the daily social impact of COVID-19 across the US. And so we have done that by publishing these reports. And we usually are able to get 3, 4, 5 of these out in a week. I think we've now done 35 or 40 of these reports. And I just want to share with you some of what we are learning and how we are using this data resource to gain insight into the impact of the pandemic. So we've done mostly 5 types of reports. One that we call hotspot reports, where we're identifying the relative impact in different places. Some that are forecasting, where we look at the data and try to project what that might mean in terms of future impact. Policy impact, where we can align these data with different policy decisions or priorities and see what it tells us and how we might evaluate the impact of those policies. We can look at things that are trending, and we can look at particular groups that might be affected disproportionately. So I'm going to walk through some of those. This is a series of charts from a dozen different states that look very much like that first food chart that I showed you. And so we can look, whether it's at a county level or a zip code level or here a state level, we can look at what these gross kind of large patterns look like in different places. And while it's clear that all of these charts show the same general temporal peaks, their patterns are actually different. So some of them peaked earlier, some of them declined slower, some of them aren't declining yet at all, and some of them have seen declines followed by increases. So some similarities, but a lot of locally based differences in how these impacts are being experienced. I mentioned this before. This seems like everyone was focusing on the toilet paper shortages. 211s actually take calls from people who need items like diapers and toilet paper. And while it's not a major reason that people call, the proportion of people who've been calling about this, particularly early in the pandemic, were dramatically higher. In every place, all but one of the states that we looked at, they had doubled the rates of these requests. And the diapers one I want to focus on just for a minute. Not everyone thinks about this. If your child is in, if your infant or toddler is in daycare and that daycare is closed and that daycare provided diapers for your baby or your child 8 hours a day, 5 days a week, guess what? Diapers aren't cheap. And now, you had not budgeted for that. And that's a real financial need for a lot of people. So we were able to document that, in fact, people are calling 211 for looking for diapers and toilet paper. Another kind of under the radar need, and this is unfortunate but true. If a loved one dies and you are you're financially constrained, burial, even cremation or a funeral, these are not free services and they are not cheap services. And so again, 211's code requests for assistance with burials. And we have seen in many of the states that have been hardest hit with COVID deaths, we have seen big increases in the requests for burial assistance. And even those that are able to provide some support, and some of the states have allocated resources to this, it really doesn't pay for a meaningful portion of that cost, even for cremation, which is the lowest cost of the options. So we see those. So just in terms of looking at where these needs are highest. We began to look at the unemployment claims, and I just want to be clear that 211 is not necessarily the first place someone would call when if they were going to place an unemployment claim. But what 211's found was a lot of people were calling them because they couldn't get through. They couldn't access the unemployment claims services within their state. And what we saw was this dramatic increase in the number of these calls, but also that they were increasing. And so as these first few unemployment claims reports came out, we actually projected with this report that based on what 211's were seeing, there were many more unemployment claims to come. This was back in the first week of April. Unfortunately, that was correct, and we've seen a continuation week after week of these claims. This next chart, which is relatively new from the last week or so, I want to credit Jean Kahn, whose family endowed the professorship I hold. And Jean, in a meeting a couple of weeks ago, said, you know what you might look at is which places in the US have the most service sector workers, because they're the ones that would be disproportionately affected by unemployment, and perhaps they would also be associated with different social need requests. And Jean, as is often the case, his instincts were correct. And so what we did here was we plotted personal care and service occupations. This is a classification from labor statistics, and it includes, it's not comprehensive, but includes things like, hairstylists and barbers, and nail salon people would be in here as well. And we looked at the rate of, we looked at the proportion of the workforce in different metropolitan areas in the US, and they varied in terms of how many of those service sector workers they had. And as that proportion went up in the labor statistics, so too did the requests for rent assistance post-COVID. So Jean, we need to make you an honorary scientist. Here's a different version of that that's specific to Missouri. This actually isn't posted yet, but will be later today on the Focus 19 page. And this looks at the proportion of the population, the portion of the workforce that has filed an unemployment claim by county in Missouri. That's the horizontal or x-axis here. And then the y-axis is the number of requests, the rate of requests for rent assistance to 211. And again, the pattern here is pretty unmistakable. As we see higher per capita claims for unemployment, we see higher per capita rates of requests for rent assistance from 211. This is an analysis that we did building upon a group called the Eviction Lab at Princeton University. And one of the things that the Eviction Lab did was created a scorecard of policies across the US and rated those policies as they related to the amount of protection they provided to renters. So some states have a lot of protections for renters, some states have weak protections for renters. And we used the Eviction Lab's scorecard to classify states in our database as to whether they had weaker protections for renters or stronger protection for renters. And what we saw was, even before COVID hit, states that had weaker protections for renters, this greenish dot here, they were generating more requests for rent assistance than were states that had strong protection for renters. But more importantly, as the COVID pandemic played out, we can see that the rate of increase in rent requests was in fact greater. That slope is steeper for people living in states with weaker protections for renters. And then most recently, and I'm not picking on Illinois here, I just grabbed their reopening plan, but a lot of states, most states have plans like this of sort of a phased reopening. And what I want to point out here is that the childcare portion of reopening happens here in Illinois in a later phase, in phase 4. What happens before then? Well, in phase 2, non-essential retail stores reopen, and so they can at least provide curbside pickup and delivery in Illinois. In phase 3, other job classifications, manufacturing, office work, retail, barber shops and salons, they can all reopen in phase 2. So think for a minute, what does it mean if you are in a job classification that reopens in phase 2 or 3 and you have children, but the childcare doesn't resume until phase 4, right? Kind of a challenge. So our team, in particular, Iram Javed on our team, said we should look at this. And what she found was, I think, really quite remarkable. So she's looking at childcare requests to 211 here. That's what these bars are. And here's COVID-19, the beginning of it. So requests are relatively stable. COVID hits and requests for childcare drop. Exactly what we would expect. People are now at home. Their kids are at home. You don't need childcare as much. But as states begin to reopen, look what's happening. We're seeing more and more increases in requests for childcare. So we're going to continue to track this as one potential indicator of, how, I don't want to be critical here, but I mean, in some ways, the misalignment of reopening has real impacts on people's lives. Let me say a few words about some of the things we've observed about who is affected most by this. Some of these will be less surprising than others, but we looked at requests for food and rent to 211 based on the poverty level of the zip code that the caller was from. And what this little infographic shows is over here on the left, the people that are colored in red represent those who are living in high poverty zip codes. Those people live in zip codes where at least one in four people is living at or below the poverty line. And so all the callers to 211, 10% of them live in these high poverty zip codes. Most of them, the blue people, live in zip codes that have a poverty rate of somewhere between 5 and 25%. And then these green people here live in low poverty zip codes, less than 5% of the population in poverty. So even though only 1 in 10 callers to 211 is from a high poverty zip code, I'm sorry, this is people living in the states served by these 211s. So 10% of the population live in low poverty zip codes, but they make up almost 40% of the requests for needs for food and almost 25% of the requests for rent or mortgage post-COVID. So again, a clear disproportionate impact on the most vulnerable populations. What's interesting is that the green people here, the low poverty zip codes, they actually have the highest rate of increase from pre-COVID to post-COVID. Again, we think illustrating that the economic impacts of this are far-reaching, even if it's in smaller proportions among low poverty areas. And then this is from another analysis we did looking at how pre to post-COVID types of requests varied for different groups. And the main point here is this second pair of bars down here is looking at older adults, those who are 70 and over. This top bar is what they called about before COVID, and the bottom bar is what they called about after COVID. And what we see is there weren't many changes up here among those who were younger than 70, but among those who were 70 or older, big differences in really food, that the food requests have increased significantly in that group. All of this work has attracted a good bit of attention from local media. This is part of the goal, I think, is to use these data to shine a light on particular problems and particular places. And so we have been working hard to try to work with reporters and journalists and local 211s and United Ways to get this story out. Some of them even in more national places. And so we're pleased with that. That's not obviously the only goal, but it's certainly part of the key to moving forward. And I'll just wrap up with this. One of the challenges that 211s and frankly our country faces in addressing this dramatic increase in social needs is that the agencies that typically respond to these sorts of needs and referrals have limited capacity. And so that social service system, as it were, is vulnerable. And this is something that we have studied in other work from our lab. This is a paper that came out about a month ago where we looked at the capacity of local social service agencies to respond to 50 different social needs. And just to give you kind of a very quick sense of what that research found is that in most communities, capacity, this is capacity low over here and high over here, the capacity to respond to social needs for some things like food pantries, tax preparation, are really quite good. But the capacity to deal with other needs, particularly housing related needs, here's low cost housing, here's rent assistance, is actually much, much lower. And so the likelihood that we're going to be able to respond adequately with existing social service resources to the economic fallout of COVID, I think is low. We also know that system capacity to respond to these social needs varies a lot by place. So here's a map of Missouri, and we're plotting system capacity where green is good. Green means there's a lot of resources available to help people. Red is low. And you can see that through the population centers of Missouri, St. Louis, Columbia, Jefferson City, Kansas City, there's fairly good resources for people paying electric bills. But down here in the Ozark and Boot Heel region, much less capacity. So we know that capacity varies by social need. We know that capacity varies by place. And this slide shows you that capacity varies by place and type of need. So here's that same map that we just looked at, but now we're looking at rent assistance. And you can see that there's much more red on this map, indicating that if you are in one of those counties and you're looking for needing assistance paying rent, the likelihood that you find it is probably going to be quite low in the current, given current resources. And then last slide, what we've also done is plotted some of these different social needs along intersecting axes of prevalence. So how common is the need? That's going horizontally across this chart. And system capacity going vertically across the chart. So at the top, these would be social needs for which there's a lot of capacity, and at the bottom of the chart, low capacity. So I would call your attention actually to this lower right-hand quadrant of this 2x2, because the needs, the social needs that are here are both quite common and they have relatively low system capacity. And so these are, I think, things that are going to be particularly challenging for us in responding to the hardship that's that many people are experiencing post-COVID. And so big ones that are in here are related to rent assistance, low-cost housing, shelter. And I think one of the truths of this pandemic is that problems, social problems, health problems, and inequalities that existed before the pandemic are only going to be worse during and after the pandemic. And so trying to focus our efforts on solutions in those areas is going to be very important. I am really grateful for all of you who turned out. I'm sorry that I can't see you. If some of you have posted questions to the chat, I'll be happy to do my best to answer those now. And I'll let Janet and Gary sort of pass those along. Thank you very much.
Thank you so much, Matt. This was incredibly informative, and we've also been posting links to your sites, both for the Focus and the 211 site, so that folks can go to the site and play around with some of this data themselves. And so, and there are a bunch of questions, but my first question is, what was the genesis of this project? Were you already working at looking at the 211 system when the pandemic began and ended up with this kind of natural experiment? Or did you put all of these pieces in place, right as this was happening?
Good question. Thank you, Gary. So actually, we've been working with 211s for 13 years. And actually, I learned about 211 in a meeting. I was presenting to the Missouri Foundation for Health, and the presentation right before me was these United Way people talking about something I'd never heard of called 211, and it was so unbelievably compelling. Like I didn't want to do my presentation afterwards because theirs was so tremendous. And so really, the week after that, I was at the United Way offices saying, hey, we want to work with you on this. So we've been partnering with them for a long time. We've been running the dashboards for almost 5 years. It'll be 5 years in October. So, so we had the data, and we immediately noticed as COVID was taking hold, we noticed these big spikes in what was happening. And so we really felt obligated to share that in a more, sort of substantive way to try to call attention to that. And just one last point about this. So I have focused mostly on what the data say about the dramatic increases in volume for these requests. Bear in mind, 211s are workplaces like many people on this call are a part of. And imagine that you show up at your work one week and the volume of your job triples, quadruples, increases by tenfold. What these helplines have done, I think, is nothing short of heroic. So we appropriately are applauding healthcare workers and essential workers and people in grocery stores. But the 211s have, they should be in that conversation as well. I mean, they have done amazing things with tiny budgets and just unbelievable creativity to be able to help their communities.
And we've also received a couple of questions from Charles and from Sal, and they're asking, is there a way to disaggregate this data by race and ethnicity to see the impacts within communities of color?
Yeah, so the reason that, when I looked at poverty data, we did it at the zip code level, is that 211s do not collect, maybe one or two, but by and large, they do not collect race ethnicity data about their callers. Some collect age data, and where they do that, you can often find that on our dashboard, but it's usually not specific ages, it's age categories. Some people, some 211s capture whether the caller identifies as male or female. Some 211s capture whether the caller is a veteran or not, but not race ethnicity data. I will tell you in the 211, so we've done over the years many large studies with 211s across the country, and I would tell you that the callers are disproportionately women. Roughly 80 to 85% of those who call 211 typically before COVID are women, and more than half of those have minor children living in the home. So a typical 211 caller is a woman with children who just doesn't make enough money to live in 2020. And callers are disproportionately racial and ethnic minorities, but not exclusively.
Matt, fantastically informative presentation. One of the questions that several people have asked is, can we have your slides? Would you be able to share this with us so that we can post on the website?
I think we can do that.
That would be wonderful. Then I'd also like to pivot a follow-up question to what we were talking about regarding extrapolating for minorities is the question of people that are not English language speakers. Do we have any data about that in 211? Both data and resources, if English is not your first or primary language, getting access to these important resources?
Yeah, great question. So the short answer is yes. So 211s are quite good at this. I would say but it varies. I mean, each of these, there are over 200 different 211s. Some of them operate at a state level. Some of them are specific to a single county. And those that have the larger 211s that serve populations where there's a high proportion of non-English speaking adults will have bilingual specialists in their call centers. Those who don't, where there's not necessarily a critical mass of non-English speakers, they have services where they can call any time of day translators and be engaged in a three-way conversation between the caller, the 211 specialist locally, and a translator. And I don't know if the 211s capture, like, if they record when that sort of language translation service is being provided, or even what language it is. I have never seen those data. We don't receive those data. So I'm going to ask about that. That's a good question. So 211s can provide that service, but we don't necessarily know whether any of these requests is from someone who's a non-English speaker.
And I wanted to share another idea that Gene Kahn has come up with. So given how genius his first one was, I figured it merited also bringing this one to your attention. And it says that basically we're seeing a lot of social unrest as a result of the killing of George Floyd and just, structural racism and oppression in general. And he's wondering if there would be an opportunity to do analysis to see that those particular areas where there is a greater demonstration of social unrest, if they are somehow, requiring more services or tapping into the 211 system.
Yeah, it's a super interesting question. Understanding social causation, how do these different social forces cause or relate to one another, is fascinating and also unbelievably complex, sort of scientifically it's easy to sort of speculate about it. And I've thought the same things as it sounds like Gene put in this chat, that people have been cooped up. They have been out of contact with others. Many of them enduring really dramatic economic hardship and changes. And then you get this this racial insult again on top of that, and you have this, I think, completely understandable but explosive sort of response. And our data might be helpful in that regard, to see whether maybe places that have had more demonstrations, or whether they are characterized by maybe more rapidly increasing needs, or needs that are declining more slowly. I think that's a really interesting question and timely. Thank you, Gene.
So a question from Sarah. She's wondering whether we have any data on 211 calls in intimate partner violence, domestic violence in this time of COVID.
Short answer is yes. I mean, there are classifications for that. Let me use my response to this question to maybe also clarify something about 211. So we have kind of an expression on our team thinking about 211 that if you want a burger, you don't go to a chicken restaurant. And that's true, I think, of some of these helpline services as well. So there are some of the reasons that people might call 211 are really unique to 211. Like, there's no other place you would go. You would go to 211 with a food request. You'd go to 211 with a rent request. You'd go to 211 needing help paying utilities. But for some of these needs, there are other places you might go. So crisis intervention hotlines, senior services hotlines, veteran services hotlines. So some of these places, 211 may not be the best barometer for that need. And I think domestic violence services is sort of on the fence there, where there are, in many communities, there are other places that you might go for that information. But 211 is one of them. And so there are those data. It is not as high a volume of a request category, but if you go to those 211 counts dashboards that we showed before, you can see, for any community and any zip code, you can actually see what the rate is and what the number of requests are and whether those are going up and down. And that's a good suggestion. We need to look at that and haven't done it yet. The one other detail I'll add about the domestic violence reports is that in our dashboard, when we get really low numbers of requests, particularly in counties or zip codes where there's low population density, we actually won't report the number. So once we get below 5 requests, we will just put less than 5. And the reason for that is, you can imagine this, if you lived in a very sparsely populated rural community and you called 211 about domestic violence, and they also classified your age range, you might be able to narrow that down pretty quickly. And so we want to be sure that in sharing these data for social impact, we're not inadvertently compromising anybody's privacy and safety. Thanks for the question.
So Matt, we have another question from Edmund, who's talking about, as a result of the economic toll that that COVID-19 is having, particularly on state and municipality tax revenue, that budgets are inevitably going to be cut, and that will weaken a public social safety net. Will your data set be able to, explore the impact of that as that's happening? And are there any other kind of types of predictions that you can anticipate happening?
So, terrific question, and it makes me realize I omitted a really important detail. So there's one other thing that 211's code for every request, and that is what they call, the 211's call it unmet need. What it really means is that they cannot provide a referral. And so 211's would classify a caller's request as an unmet need under two conditions. The first would be that, let's say, Gary, that you call 211 and you are looking for an automobile repair. You have a car, but you have a major repair needed and you don't have the money. It could be that in your zip code that there's no auto repair service provider that serves your zip code. That would be classified as an unmet need. The second condition would be there is an auto repair service provider that serves your zip code, but they are completely tapped out of resources, and so they're not accepting new referrals. So either of those would be classified as an unmet need. So to the question, we will be able to monitor whether the proportion of unmet needs increases over time, and if it increases over time in certain categories. And so that would be, I think, a decent indicator of how cuts for some of these programs might be affecting people. But I want to take a glass half full perspective about the question, and that is that what our real hope is that data such as these can shine a light on the types of needs and the kinds of places where resources are needed most, so that as we allocate what are clearly finite resources, we do it in a way that's informed by data and can do the most good for the most people. And so I hope, and we are trying to position ourselves to have that sort of influence as solutions roll out.
So I can see that we are just out of time. Matt, I wanted to offer you an opportunity to make some closing comments, and then Janet will take us out.
Again, thank you for the opportunity, Gary and Janet. Thanks to all of you for joining today. And just to reiterate that everybody needs to be involved in efforts to bring our communities forward and out of this position that we're in. And we really look forward to doing that with you whenever we can. Thank you.
Thanks, Matt and Gary. Wonderful presentation today. And I want to invite everyone who's with us to join us again on Thursday. Open Classroom will be back at 12:30 with a talk called Your Intervention is Ready, Now What? Delivered by Anna Bauman, and Rebecca Legnick-Paul. This will be sort of an introduction to implementation science and how to implement an evidence-based practice with fidelity and attention to the particular needs of a community that you're serving. So it should be a very interesting talk, and we would be delighted to have you join us. Please visit our webpage to register if you haven't done so already. And with that, we are at time, so we send you off, wishing you well. Stay safe, everybody, and hope to see you back very soon. Bye now.